Thank you for coming in today. I'm one of 3,000 of Walden University's learners. I'm just here, you know, trying to get a feel for exactly what the needs of our clients are. So, can you tell me what brings you in today?
Hello, I was referred to you due to a series of events that are now threatening my practice. I guess I'm supposed to talk to you and fulfill the necessary requirements to continue practicing.
I will do my best to assist you, Mrs.
It's Dr. June Doe. I'm not someone afforded with a great deal of time. I'm calling you because the hospital administrator caught me talking to a statue out in front of the emergency room. I know it looked bad because I was in public, out in the open. However, in this day and age with technology and Bluetooth, I'm sure I looked like I was having an argument on an earpiece or something. I literally had a few bad days. So what? It's Christmas. Everyone is dressed out and a little crazy.
So, you said you've had a bad few days. So, can you tell me just a little bit more about what's happened, Dr. Doe?
I should have known you would catch that. Yes, the last few weeks I've been seeing things and hearing voices that keep me up at night.
Fascinating. Have these voices been telling you to harm yourself or anyone else by chance?
It's more like voices that I've been hearing in the past, mostly negative things I've already heard. Like one of them is my dad telling me that I don't need an education to wipe butts or bring a man a beer. Leave school to men. Or my ex-husband telling me that no one will ever really love me because I can't do anything right.
Sounds very distressing. Well, doctor, aside from the administrator, who else knows? Does your family know the struggles that you're going through right now?
No, Antonio, and I forbid you strictly from contacting them and do not give consent for you to notify them at all under any circumstances. Let me make that clear. I've talked to one colleague in the psych department who I told in hypothetical situation.
Doctor, it sounds like you're keeping your struggle to yourself. My fear is that it could be possibly more progressive than you're letting on.
I am a doctor. I know my symptoms. I will be okay. There's no need for anyone to be stressed out more than they are during the season. I'm not trying to cause a seasonal affective disorder in my home.
Can I ask if there is any history of mental health issues in your family?
I can't believe we're really doing this right now. Do you want to go over percentages and probabilities next? I heard voices, I took medications, I'm getting better. Now just please cure me so I can continue to see my clients.
Well, doctor, you mentioned medications. What kind of medications are you taking?
Represidone. It's for hallucinations, small dosages that I can taper further.
So, you have been seeing a psychiatrist according to medications, right?
No, the overlap is tiny. We read the same drug books, and I just wrote a prescription.
Doctor, you wrote a prescription for yourself?
No, I wrote it for a fictional client.
Dr. Doe, not only is that unhealthy, unethical, and illegal, you can lose your license for that behavior. You're in need of help. You have to allow us to help you.
Everyone in the medical field has sins. It's the nature of playing God on earth.
Dr. Doe, this is serious. You're prescribing yourself psych medications, hallucinating, and hearing voices. Taking this lightly can harm yourself or others that are in your care.
I know. I never thought it would get this bad so quick. I just wanted to get past New Year's.
Would you allow me to help you take some steps?
Yeah, Antonio, that'd be fine.
Well, according to this, we would be allowed to give you 3 months off, which is standard in this situation. We will ask you to refrain from performing any private practice at that time as well. You'll be required to meet regularly with a psychologist and a psychiatrist for the medications and taper off if needed. Your family deserves to know you're human, doctor. We are provided family for such situations as this. We also have a group of medical professionals that meet twice a week just to talk about stressors they endure. Those who attend talk about the relief they feel just from attending and being able to talk it out. I also want you and I to work on your self-care and kind of what any changes that we could make to relieve you from some of the stress that you're going through. And kind of look at what a typical day looks like for you outside of work.
Thank you, Antonio. I know I need this. I'll even talk to my husband when I get home tonight. I'm interested in the group and the shrink as well. I know I need this. I just don't want the stigmas attached to getting the help.
What if we treated getting help